was doing nothing.
One day it's like a miracle. It will disappear. It'll be wonderful. It'll be a gift from heaven.
It's complete. He has no idea what he's talking about.
In the searing new documentary, Totally Under Control, Oscar-winning director Alex Gibney takes us deep inside this administration's failed pandemic response that's resulted in over 214,000 American deaths and cases still on the rise in 31 states. One of the experts he's enlisted to help him is the whistleblowing scientist who finally had enough and resigned from the National Institute of Health just last week. Please welcome Alex Gibney and Dr. Rick Bright. Good morning, and thank you for, first of all, thank you for making the documentary. Thank you for bringing it to us. Alex, you've been working on this documentary for the last 7 months in secrecy? And the day after you finally put it to rest, you know who tested positive for the coronavirus? Did you consider going back and changing the film at all?
Well, actually, we've only been working on it for 5 months. We were rushing madly, 3 directors, 4 editors. And yeah, we finally got it done last Thursday, and a week ago, last Thursday, we thought we were finally finished. And then at 2 o'clock in the morning, I got the call that President Trump had declared positive for coronavirus. So that seemed a kind of fitting dark poetry for the end of the film, but because we focused really on the early days when things could have been different, and this was an avoidable tragedy. All these people didn't have to die. This number of people didn't have to be infected. It's really an avoidable tragedy, and that's what we focused on.
Joy?
Okay, so Dr. Bright, over the weekend, Trump held his first public event since testing positive for coronavirus, just 5 days after leaving the hospital. He now claims that he is immune to the virus. So as one of the country's top immunologists, what's your is he immune? Is that true?
Joy, thanks for having me here today. It's a pleasure to be on the show. The information that we heard from the president today and from his son Eric last night about immunity is just absolutely not true. There is nothing that we know today that would imply that they were immune from this virus and getting infected from this virus again. We don't even have the full story about his full infection or his level of contagiousness or if he's even cleared the virus today. It's this type of misleading, inaccurate information that continues to come forth from the president, his family, and the White House that is leading to the longevity of this pandemic itself. This type of misinformation is causing more harm than it is good.
So is this a lie also? Because his son Eric says that his dad, Donald, should get credit for pushing the vaccine since day one. Do you agree with that? Or is that another
I disagree with that completely. I was there on the inside on day one. I know that there was resistance and delays from the White House and from political officials to fund and encourage the development of vaccines early on. It actually wasn't until about April 8th or April 10th before the Secretary of HHS said maybe we should start urgently making a vaccine. Remember, I went into the White House to meet with Peter Navarro on February 8th. And in that meeting, I said, we need to have a Manhattan Project for vaccines. We need billions of dollars to get started urgently on vaccines. We didn't get that support. The White House wasn't behind it. It wasn't until April.
Sonny?
Right.
Well, Dr. Bright, you were the director of BARDA, the key office in developing drugs and vaccines to treat the coronavirus. In fact, you were the one to fast-track the Regeneron antibody cocktail eventually used to treat President Trump himself. But in April, you were removed from your post and demoted. And you say you believe it was in retaliation for refusing to make hydroxychloroquine, a drug Trump touted as a cure-all, more widely available. And you filed a whistleblower complaint. How hard was it to do your job as a scientist in this administration?
It is unbearably difficult to speak the truth in this administration. Remember, from the start of this pandemic, we have not heard the truth from the White House, from the president, about this pandemic and its risk and how deadly it can be. Whenever anyone in the administration speaks up to tell the truth, to expose the lies and the misinformation that is coming forth from the president and the White House, they are ridiculed, they are pushed aside, they are ostracized and called many names. But this is not just about me. This is about thousands and tens of thousands of scientists, great world-leading class scientists in our government who are working daily to find the truth, to tell the truth. And their truth has been overwritten by the White House. Their information has been ignored. Public health guidelines have been disparaged and ignored. This is why we have 215,000 dead Americans today. This is why we have up to 50,000 new infections today. This is why we're going to have terrible winter if we don't do something now to turn around the rhetoric, tell people the truth, and people need to follow those public health guidelines.
President Trump dismissed you as an angry, disgruntled employee who didn't do a very good job. Those are his words. What is your response to that?
Those are the same words we hear from President Trump about every single person across the government who has spoken up to tell the truth. These are upstanding, hardworking civil servants who have dedicated their lives, as I have, to serving our country, protecting Americans. Whenever one of them speaks up, when I spoke up, he calls us a disgruntled employee. He says we're disloyal. He even tweeted that I was a creep. It's childish behavior from a leader of the United States, when he should be focused on telling Americans the truth about the risk of this virus, and he should be leading by example, wearing a mask, encouraging social distancing, not having indoor rallies so people can be protected and not get infected from this deadly virus.
Joy.
Yes, Alex, this is a great film. Everybody should watch it if you want to see what happened here. Since January, I guess. And you interviewed countless scientists, didn't you? Medical professionals and government officials for the film. But you couldn't get current members of the Trump administration, the CDC or the FDA. They would not agree to talk to you on the record. Why is that?
Good question. I mean, from the very moment we started the film, we reached out to HHS, we reached out to the White House, we reached out to CDC, we reached out to FDA. No one would agree to speak to us on the record. I should tell you, though, that one of the most disquieting things was that we also reached out to a number of people inside the CDC who, off the record, were terrified. They felt that their emails were being monitored, their phone calls were being monitored, and they were desperately afraid that if they talked up, they would be retaliated against.
In what way? What do they think will happen to them? Retaliated against in what way? You mean violence, physical retaliation?
They would be fired or publicly humiliated. I mean, I think that there was tremendous pressure for scientists to be able to steer scientific fact in a political direction for the benefit of the Trump administration. And indeed, they installed an official, Michael Caputo, with whom we spoke a number of times, whose job it was to make sure that nobody from the CDC spoke out in any way by telling the truth in any way that would offend or steer against what the Trump administration was trying to put out as a matter of propaganda.
That's a cover-up.
Well, Dr. Bright, you say many of your former colleagues in the administration also acknowledge the pressure they're getting from the White House to stay on message. If this is true, then can we trust even what Dr. Fauci is saying or the guidelines that the CDC is putting out?
We need to hear directly from the scientists at the CDC, at the FDA, and at the NIH. If the message from those career scientists is getting filtered or manipulated or overruled or rewritten by the White House or by politicians, then we can't trust that information. So we need to give them the ability to speak up and tell the truth. We need to listen to the career scientists underneath the director of the CDC. We need to hear to Dr. Fauci, but Dr. Fauci's words are even being manipulated and changed and misconstrued. And so even with strong leaders that we have with Dr. Fauci and others, it's still very difficult to get the truth out of this administration.
Well, knowing the pressure that the scientists are under to fast track a vaccine, what is your advice to Americans? Should they take it once it's available? Should they not?
You know, it's a really good question. A vaccine is going to be one of the most important tools to help us get through and end this pandemic. Americans need to be able to trust that vaccine and making sure that it has been fully evaluated by scientists and experts who know and will say that it is safe to use and it works. If the scientists and the FDA advisory panel that is comprised of world-leading scientists and experts, if they say that it is safe and can be used, and if that message is accepted by the FDA and not manipulated, not overruled or rewritten by the HHS secretary or the White House, then I believe we can trust the experts. But if the White House intervenes, if the White House pressures, then I think we need to evaluate our decisions very carefully.
So I want to ask a really fast question. If Biden gets elected, do you think he'll be able to get this under control with you all's help?
You know, I think this is about leadership, and we need strong leadership, and we're not seeing that in the White House today. Remember, this pandemic, this virus is not a political issue. It is about life and death. And what we need are honest leaders who will guide our country through it.
Gotcha. Thanks to Alex Gibney and Dr. Rick Bright. Totally Under Control will be available tomorrow. Please watch it. It's important. It will be on Apple TV.